We have tremendous power over our health, destiny, and longevity. The vast majority of premature death and disability is preventable with a plant-based diet and other healthy lifestyle behaviors.
In 1995, as a young medical resident, I was diagnosed with multiple sclerosis, and it truly changed the course of my life. 8 years into the diagnosis, I was dependent on a crutch or cane, and at that time, I was taking about a dozen medicines. And in 2003, by chance, I came across literature that discussed the connection between diet and disease, and I was struck by this because I had never learned this in medical school. And I was so curious that I delved into the literature and really tried to understand the connections that existed, and I was struck by what I had learned. And it was then that I decided that I was going to better manage my personal disease by modifying not only my diet, but my lifestyle. And extraordinarily, within a few months, I started to feel better. And today, 23 years since my diagnosis, I'm medication-free and disability-free and empowered more than ever before to share this healing message.
4 months after I had my third child, I developed rheumatoid arthritis, and I was told that my illness was my prognosis was poor, and that my disease was quite debilitating. I was worried I wouldn't practice cardiology. I was so sick. There were moments when I went from I'm an active runner to not being able to climb the stairs. So I was very debilitated. And when you go through something like that, you are looking for places of hope. And I happened to find a person in my life who showed me and made me start thinking that maybe there is something else, that there are other factors that play into why people get sick. And
Currently, we average only about 24 hours of nutrition training in medical school out of thousands of hours of preclinical instruction. Right? And also, it's not just the quantity. What are we teaching students? Is it just the Krebs cycle over again? Is it just the biochemistry of vitamins? Or is it clinical nutrition, using nutrition approaches to prevent, arrest, and reverse disease? That's the critical information that we need to get into medical training.
So when I talk to clinicians who are not interested or who don't know too much about nutrition, I say, you know, I know, because I was you. I didn't know a lot about nutrition either, and and we've surveyed this. We did a study in that was published recently that showed that 59% of cardiologists, for instance, say that they've never received any nutrition education in medical school, and then 30-some, I can't remember, 33% or so say they've received minimal. So it ends up being about 90% of cardiologists say they receive minimal to no education. So they are not alone.
Oh, well, the Plantrician Project, what they've done is, take the evidence-based nutrition stance and try to get it out into the world. Look, how else can we make decisions as life and death important as to what to eat and what to feed our families, then by the best available balance of evidence?
The Plantrician Project represents like a North Star, a clear voice in the confusion of the whole diet conversation in the world. And it's a clear voice because we're only seeking truth. We're not seeking to defend a position. We're not seeking to profit on a position. We're simply seeking truth to change lives. And the truth has led us through the research to whole food plant-based nutrition as the optimal dietary intervention for people that have lifestyle-related diseases. But it just so happens that a whole food plant-based diet is not only optimal for human health, but it's optimal for our environment. It's optimal for animal welfare, and it's optimal for the healthcare system. And so Plantrician represents this beautiful, true north vision that this one solution of whole food plant-based nutrition can impact so many important areas around the world and begin regenerating healthcare and animal care and the environment and individuals and families.
Imagine if we had a world where we had doctors that can all speak to this universally and ubiquitously. We could turn the tide of this chronic illness epidemic. And I hope I have the opportunity to witness that.